Hello everybody, my name is Mats Granström of Interverbum Technology in Sweden. I would like to introduce the PPCP project. The problems for patients and non-specialists to understand their electronic patient records have initiated a project with Nordic Innovation, where 3 companies jointly have developed a solution. Here, a combination of semantic recognition software, a powerful term-based management tool, and intelligent terminology data collection enables the non-specialists to understand problematic terms and abbreviations. The system is called PPCP, Patient Professional Communication Plugin. We will thus see how a multilingual, multi-purpose terminology and knowledge management system can be used as a support for understanding specialized professional language, getting explanations in everyday language or in your mother tongue. And also as a controlled language support system to select the preferred, most unambiguous terms while creating text, for example, while registering a medical record. The examples I will show are from the life science sector, specifically heart attack-related texts. But this is, of course, a generic system that could be used for any subject area. Let me log into the system. As mentioned, PPCP was developed as a cooperative Nordic innovation project. Thus, one of the 4 main Nordic region languages can be selected as interface, a user interface languages. I'll select Swedish and I log in. Here you can, as an example, paste text from your medical record, your online medical record. We have prepared some examples from real-life medical records. So here we put the text in the left part of the screen. And the system now works, looks up if it finds any terminology in the database behind. Let's click one of the blue terms, which is one of the identified terms. Here we got an example of anaphylaxis, which is, of course, understandable for a doctor. And the synonyms are allergisk reaktion, överkänslighetsreaktion, which everyday people would understand. The preferred term is actually anaphylactic reaction to be used in the medical record. We'll come back to that. So put the text here, and it's compared to what is in the database behind, and all the terms that I found are marked with blue, and you can click them to find the corresponding terms. In this case, you can see that we got English and Swedish terms, right? And if you happen not to have Swedish as a mother tongue, you can select other languages to display. This is the multilingual database behind. So let's say I need, for example, Icelandic or maybe Arabic. You just update the search and you'll find more results to the right. That, for example, this hereditet, anaphylaxis again, will find the terms also in Icelandic and in Arabic, both professional terminology and everyday language explanatory translation, if you wish, of the term. So here you get help to understand your medical record, irrespective of educational level and mother tongue, which also, of course, puts load off the healthcare system, because you don't need to call if you don't understand your record, what your doctor has written. You can get help this way. There is also a possibility to use the connected term database for producing consistent, stringent text. Let's say we can find, well, we have some sample texts from a medical record that's being written. So I just cleared the screen here, and I have prepared some text here. Let's take this. It could be sentences that are being written in a medical record, right? Let's mark this text and copy it. Go back to PPCP and also select another function here. So and paste the text here. And now we can see that the same thing happens here. But here we have a focus on the searching of terms deprecated versus preferred terms. As you can see, we have caput femori. That is caput femoris actually is the recommended term in professional Swedish, right? But the lårbenshuvud is not. It's understandable for an everyday person, but it's not the preferred term. So this is controlled language, if you wish. Let's click here. Amnestisk störning is not the preferred term. But minnesstörning, it's understandable and a precise term. So now these are two examples of how you can utilize a database, a term database. Let's look a bit behind the scene. We go to the TermWeb system and log in. I already logged in and I can perform different searches. Let's take the word in Swedish. We have the Swedish as a source language, anaphylaxis, and you can find how it looks behind the scene. Here we have the Swedish term, and we have terms in all the Nordic languages, more or less, Nordic region languages, I should say, and Finnish, Icelandic, Danish, Norwegian, and Swedish, and also some other minority languages, if we wish, immigrant languages, minority languages in the term database. So it's all connected, actually connected also to a SNOMED CT ID here. So this is how it looks. So to summarize again, the contents of this corporate terminology database can, in TermWeb in this case, can be used to find the best terms during translation. That's obvious. If you translate from Swedish, you find this word and you see that, oh, okay, it means anaphylaxia in Finnish. That's not complicated, but that's of course an obvious use of a terminology, of multilingual terminology database. That's the first thing, of course. And the second thing is to find more useful knowledge about a certain term. Let's look at another example here. This arteria A. femoralis. You can, if you wonder what this is, you can of course get the translations and the explanations, and that's also with images. So you can have multimedia, not only images, but also video clips for instruction and sound clips and whatever you wish to have supporting your system. So it's more of a knowledge management system. You look up encyclopedia if you wish to look up information. And another thing is, of course, that you can have multimedia. Apart from multimedia, I would say, here you can see that we have a possibility to look at to jump between related concepts. So here you can see that hjärtinfarkt, myocardial infarction in English, has a number of relations, both of types of myocardial infarctions and also reasons or symptoms of possible symptoms of myocardial infarction, as you can see here. General symptom of myocardial infarction, right? And you also, if you click this show graph here, you would also be able to see the relationships in a graphical mode. So here you can see the same thing: acute hjärtinfarkt hjärtinfarkt i framväg, and another type of myocardial infarction, and also all these symptoms that might be connected to a myocardial infarction. So it's a knowledge database with graphical view and with images, with multimedia, or different types of multimedia objects. Furthermore, you will be able to have reference. You can put whatever you want in this database. So you can have reference information. This is, for example, an interesting paper on health literacy. So you can see that we will have will be able to read it. You have a link here, so you can read what it is. That's from the NHS in Scotland, and there is with exactly one description of the problems with low literacy, and of course maybe different languages as well. So this is the problem we faced and solved during the project. So more information can be found, of course. And then again, of course, direct help that we already described. Direct help to understand a complicated professional text. A full stop feberalis for a normal Swede would not be easily understandable. So that we have explanations as I showed before. And of course, while creating text, you get help to use the most correct and unambiguous term while you, for example, are creating a medical record or whatever type of technical information you are entering into a system. Well, this was just a little hint about what is in the what has been produced in the PPCP project, the Nordic Innovation project, PPCP. And of course, if you would like to have more information, obviously, you're welcome to contact us, and you can find our contact details at our website of one of the partners. So here we go, contact, yeah. Thank you very much for your attention. Bye-bye.